it simply has no blood flowing down into it. As soon as you release the blood flow into the tissue, it's going to become flush with blood because these precapillary sphincters now are wide open because we've made the tissue hypoxic. Yes?
So for example, like if you take a string, like I know now, so I used to do this, I used to tie it around my finger. Is that why like it would kind of start hurting because of the lactic acid?
Well, without blood flow, you may feel some paresthesias,
Right.
some numbness and tingling. I'll give you a real life example one time.
So are you saying the pH is lower when?
When acid builds up, the pH falls.
Oh yeah, there we go. Okay.
Okay. Okay, so we had a patient come into the ER one time who had a clot blocking blood flow down his right lower extremity. Okay, so when the patient came in, his distal extremity was ischemic. In other words, it was pale. It was painful. It was cool to touch. The patient underwent an emergency pop bypass, okay, where blood flow was restored like this. A little bypass graft. Okay. Then I'm in the hospital. I get a stat call to the recovery room because the nurse was concerned that the patient's leg was infected. So I go to see the patient, and what she was referring to was the fact that the entire lower extremity was red, warm, and slightly swollen. Okay? Was that something to be concerned about? No. That was simply this phenomenon. The leg had been ischemic, and so all the precapillary sphincters were wide open. Once you reestablish blood flow, the tissue becomes flush, okay, with blood, okay? And it's simply because that capillary bed is as open as it possibly can, okay? And so blood is beginning even to extravasate from the capillaries into the surrounding tissue, so it's even a little bit swollen. We call this post-ischemic reperfusion. Ischemia is just a term that means that the tissue is not getting enough blood flow with oxygen. So after you restore blood flow, that tissue reperfuses. It becomes flushed with blood. Okay. So, what do you think the issue was for that nurse? She was a rookie. She had never seen anything like this before. Would somebody, if someone had an infection that they developed from the surgery, would it show up so quickly in the recovery room? No. No. They're not going to have a post-operative infection that soon.
Do they go out? They go back in and remove the clot eventually, right? Or do they just leave it? Or?
Oh, with this? No, they leave it alone.
Okay.
Do they check it?
What's that?
Do they check the clot to make sure that it's
No,
still
but what
in
they'll
place,
keep the patient on anticoagulants.
or- Okay.
Okay. So on the anticoagulants, that clot will eventually dissolve.
Okay.
In fact, they're not only keep the patient on anticoagulants, but also on the antiplatelet drugs. Let's talk about the venous system. Okay. We said the smallest veins are called venules. Okay. Smallest ones are the ones that are posterior to or distal to the capillaries. We call these postcapillary venules. And they're not too much different in appearance from a capillary. But as you move from capillaries to venules, you begin to pick up 1 to 2 to 3 layers of smooth muscle within the tunica medium. But when you reach a little bit larger size vessel, a vein, you have 3 distinct layers. Okay? Again, compared to arteries, the tunica media is relatively thin and the tunica externa is thicker. One major difference between arteries and veins is that veins have valves. Yeah.
I was gonna ask, when it does bypass the capillary beds, in that case, would the veins carry the oxygenated blood, or would it like go to the next artery, or when it goes straight from the arterial to the venule and it
Oh.
bypasses?
You mean when it bypasses?
Yeah. So in that case, would veins be carrying oxygenated blood?
Well,
Because the exchange doesn't.
yeah, it's all relative. It's all relative
Okay.
and so, yeah, that blood that is bypassing the capillary bed is going to be a little bit more oxygen rich. All right. Now, the valves. Think of this as a vein running within the lower extremity. This could be, for instance, a superficial femoral vein. I'm drawing the two intima here. That's facing the lumen. They're going to be little cosmic standing outward from the tunica intima that form the venous valve like this. Okay. And they're located all along the peripheral veins like this. And what these valves do is they only permit blood flow in one direction, or the heart. So these valves will allow blood to flow in this direction. But if blood flow begins to back up, what happens to this valve? It closes. It prevents regurgitation distally. The presence of valves is a mechanism to assist with venous return. And the reason this adaptation is necessary is because veins have relatively low pressure. And so that low pressure is all you have to push blood back up to the heart. Okay? Against gravity in the case of the lower extremities. Okay? So the presence of valves helps prevent the blood from regurgitating back, moving in only one direction, toward the heart. Okay. We're going to talk briefly about hemodynamics. The study of blood flow, circulation. Okay, includes concepts like blood pressure, blood flow, vascular resistance, and cardiac output. When we say blood flow, we're talking about the volume of blood flowing through a vessel, an organ, or the entire circulation in a given period. In most cases, except when we're talking about the entire circulation, we use units of milliliters per minute. For instance, renal blood flow may normally be 120 milliliters per minute. When we start talking about the blood flow through the entire circulation, the number gets to be relatively high, so we convert milliliters to liters per minute. When we're talking about cardiac output, which is the circulation, the entire circulation. Okay. So cardiac output is the blood flow through the entire circulation expressed in liters per minute. Okay. Cardiac output is equal to the stroke volume, the amount of volume ejected per beat, times the number of beats per minute. So it represents the total amount of blood ejected or pumped by the left ventricle over a minute's period of time. And that should be exactly equal to the amount of blood pumped by the right ventricle. They should be matched up. That's called the cardiac output. Okay. Regional blood flow may vary despite a constant cardiac output. What do we mean by that? Okay. For instance, let's suppose you're running and this is a capillary bed that's feeding the muscles of your lower extremities. Well, blood is going to be diverted to these muscles, okay? If this is a capillary bed serving your GI tract, when you're running, these precapillary sphincters are going to close. That cardiac output is going to be directed more toward the muscles, less toward your GI tract. Now, let's say you stop running, you're at the finish line, they have some gumbo, maybe beer like they do in some of those races. Okay? Then all of a sudden what happens? The capillary bed surrounding the GI tract opens up, blood flow to the muscles begins to decrease. Okay, so you can divert blood from one region to another, all the while having a stable cardiac output. We use the term blood pressure to denote the force per unit area exerted on the vessel wall by the contained blood. So the blood within a vessel is going to exert a force on the wall that contains it. And we express it traditionally in millimeters of mercury. When we use the term blood pressure, unless we specify otherwise, we're talking about systemic blood pressure. The blood pressure within the systemic circulation. Not blood pressure, for instance, in the pulmonary circulation. Okay, because that would be much, much lower. And generally, it's derived from either the aorta or the major vessels that branch off of it. What's the importance of blood pressure? Blood pressure drives blood flow. For instance, in order for blood to flow from point A to point B, there has to be a difference in pressure. Okay? So the left ventricle, the pump, generates pressure at point A. This could be the aorta. Let's say the mean blood pressure is 100 millimeters of mercury. For blood to flow from the aorta to the superficial palmar arch, there has to be a pressure gradient, okay, such that the pressure within the aorta is higher than the mean pressure within the superficial palmar arch. It's that 40 millimeter gradient that's driving blood flow, okay? It's not only driving blood flow, but it's driving the delivery of oxygen. So that oxygen is carried to all the different tissues. Okay? So blood always flows from an area of higher pressure into an area of lower pressure. Raise your hand if you understand that concept. Okay. So we'll test your understanding.
Why is it measured in mercury?
That's tradition.
Tradition.
Tradition. Because the initial blood pressure cuffs use mercury. Okay. So if you understand that concept, answer this little quiz question. Which of the following vessels has the lowest mean blood pressure? Okay. A, let's say, including B. D is going to be a pedal capillary, let's say. C would be the aortic arch. And D would be the anterior tibial artery. Okay. So, of those four vessels, in which of those vessels is the mean pressure the lowest?
A.
Okay. So, how many people say A? One person.
Shit.
Okay. How many people say pedal capillary? 1, 2, 3, 4, 5, 6, 7, 8, 9. How many people say the aortic arch?
No.
Good, good. I feel comfortable. And how many people say the anterior tibial artery? Nobody.
So
Okay.
the whole class.
So, Let's think about
Thanks, guys.
direction of blood flow.
You're probably right.
Here's the heart. Blood is pumped first of these vessels into the aortic arch. Okay, from the aortic arch, it's going to travel ultimately down to the anterior tibial. From there, it's going to pass down into some pedal capillaries. These would be pedal capillaries. And from there into the inferior vena cava, back to the heart. Okay? So there's going to be a progressive decrease in blood pressure so that the inferior vena cava would have the lowest.
I
Because
told you.
if the pressure here in the inferior vena cava was higher than in the pedal capillaries,
And it
would
wouldn't
blood flow
flow
back
that
from the
way.
inferior vena cava?
No.
No, because blood only flows from an area of high pressure to an area of low pressure.
I don't think that makes sense.
So very good, Chris.
I know we're
Okay.
all, Chris.
Now, when we say we're measuring blood pressure, we said unless we specify otherwise, we're measuring the pressure in systemic arteries. And these arteries exhibit a systolic component and a diastolic. Okay? The systolic component of the reading is the peak pressure exerted against the arterial walls when the heart contracts. When the heart contracts and pumps blood into the aorta, okay, and into then its medium-sized branches, it generates a peak pressure within those vessels. That's the systolic. But as soon as the heart begins to relax and that blood within those vessels continues forward, is propelled forward, the pressure within those vessels begins to fall. Okay? It continues to fall until the next systole. That minimum pressure that occurs right before the next systolic event would be the diastolic. So for instance, you may have a blood pressure of 120 over 70 millimeters of mercury. The 120 would be the systolic component. The 70 would be the minimal reading before the next contraction. That would be the diastolic.